This is a report on the Integrated Case Management System. As a nonpartisan, independent auditor of the Legislative Assembly, the Auditor General audits the government reporting entity. This consists of ministries, crown corporations, and other government organizations, such as universities, colleges, school districts, health authorities, and similar organizations that are controlled by or accountable to the provincial government. The Office of the Auditor General serves the people of British Columbia and their elected representatives by conducting independent audits and advising on how well government is managing its responsibilities and resources. Under the Auditor General Act, the Auditor General conducts and reports on both financial audits and performance or value for money audits. The Integrated Case Management Project was launched in 2008 as a partnership between three ministries: the Ministry of Technology, Innovation, and Citizen Services, the Ministry of Social Development and Social Innovation, and the Ministry of Children and Family Development. The project was to integrate more than 50 different aging legacy systems into ICM and improve information sharing and case management across the social service sector. ICM is used for the delivery of social programs such as child welfare, child care, income assistance, and employment services. ICM is a significant system that stores personal and in some cases highly sensitive information for more than 2.5 million individuals. For many reasons, including the importance of ICM to so many British Columbians, we decided to audit two specific aspects of ICM. The first was access management. We chose this area to determine whether client information was properly managed to prevent inappropriate access. The second area we focused on was data quality management. We wanted to determine whether data was managed to ensure the quality of client records in ICM. During our audit, however, it became clear that we also needed to look at the project scope and cost of implementation. Let's look at our third area of focus around project scope and cost first. Overall, ICM has not met expectations. Government spent $182 million and the system has not fulfilled key objectives. ICM was completed in November 2014, at which time government reported that ICM was completed on time and on budget. However, the project was incomplete. Only 1/3 of the legacy systems initially identified for replacement were actually replaced. Legacy system replacement was a big part of the initial business case for ICM, yet in the end, these systems were only partially replaced. The ministry reduced the scope of ICM implementation to stay within budget, but ICM and the legacy systems must now run concurrently. More importantly, this undercuts the original vision for a single integrated system across the social services sector. The reported project capital cost for ICM was $182 million. As with any systems implementation project, though, there were also operating costs associated with development, implementation, and maintenance of ICM. Not all of these costs were available during our audit, as the project was not yet complete. As a result, we were unable to confirm the figures for the capital and operating costs, or determine whether they were within budget. Therefore, the report includes a recommendation for the Ministry of Social Development and Social Innovation to prepare the full cost for the life of the project. Now let's look at the two areas we audited: access management and data quality management. In our examination of access to ICM, we found that personal information was not fully safeguarded. Access to client information was not always limited to need to know. In addition, essential monitoring was not in place for detecting inappropriate access and activity. The risk is that client information could be inappropriately accessed without the ministry's knowledge. It is important to protect information from inappropriate access to prevent loss of privacy and ensure confidentiality. Also of concern was the quality of client records in ICM. We found that information used to identify clients in ICM was not always accurate or complete, and duplicate records existed. The Ministry has processes in place to address data quality issues, including the establishment of a data quality team and the completion of a large-scale remediation prior to implementing the final phase of ICM. While data quality was being managed, the Ministry could do more to improve quality on an ongoing basis. Incorrect client identification could result in inaccurate record updates. And working through poor quality data can reduce valuable time staff spends with clients. In conclusion, the report contains 8 recommendations. These recommendations summarize 46 more detailed technical recommendations that we provided to the Ministry in October 2014. The Ministry has indicated that many of the 46 recommendations have been addressed or are in the process of being addressed. Our thanks to the ministries involved for their cooperation with this audit and their staff for their dedication in providing valuable social programs and supports. To read this report and our other publications, or for more information about our office, please visit our website at www.bcauditor.com.